I saw that. Was that Boston? Did you see that? School
Um,
is out.
well, Connecticut too. Because
Conne-
I work in the school system, and we're out for the next 2 weeks too.
2 weeks, but Boston did a month.
Oh, did they?
Yes.
I didn't know that.
Yeah, April 27th is the return date.
Okay, they ain't.
Like, what
Well,
is
they're a
it gonna
bigger
do?
city, so they're a lot more.
They're bigger.
Yeah.
So it's interesting how each community is trying to manage this. So it works. Let's talk about some facts. Can we talk about some facts on this thing first?
Let's go.
Let's talk about some facts. So the facts are this is a virus, and according to the Center for Disease Control, which you can access by a quick Google, pull up some fun facts. So I just want to state, our emphasis of this show is it's Black centered. So we want to give information and upliftment and just share things that are relevant and specifically for Black people. Clearly, everybody can listen and learn. All are welcome, but that's the brand of our show.
So we'll start with the myth that
So we'll start
Black
with the myth
people
that Black people
are
can't
immune
get
to this. Y'all asses can catch it too.
We like to believe it, but it does not bypass race and melanin.
It's a virus.
It's a virus. I do think there are some things that don't impact us the same way, like aging rapidly, or the opioid epidemic, or skin cancer. Like those things you don't see Black folks in as high a number as other communities. This is a little different and a little harder to get an accurate measurement of, because the only way to know for sure if you have the coronavirus is by a test. So if you have not been tested, we can't say for sure that you have it. So they can some of the numbers you see where there's a discrepancy is, one is estimates, one is people who've been exposed, and the other are people who actually went to the doctor's office and got tested. And for a while, I don't know if that's still the case, for a while, even if you went to the doctor, you still might not have been tested for it because there weren't enough tests for everybody to come in.
I know North Carolina, I think last week I had heard that for the whole state they had 200
It's
tests.
crazy.
I'm like, shit, that
What
can't
you gonna
cover
do with
that can't even cover the smallest town in North Carolina.
Right. And presently there is no cure for it. There are different treatments. If it hits your lungs and you can't breathe, there's some treatment for that. But there's no, basically, even if you do have it and if you're regular healthy, you can stay at your crib. Just don't leave. But the trick is, people can be exposed to it and carriers of it and not be symptomatic. So we know Black people traditionally are not always trusting of medical professionals or the government, reasonably so. It's not a crazy thing to not trust the government and to not be trusting of doctors, because they've done us dirty over and over again, and frequently we're ignored when it comes to studies and
AKA
tests.
the Tuskegee experiment.
The Tuskegee experiment. We can look at Black women and the mortality rate in delivery, and even in the United States. So there's good reason why Black folks don't necessarily trust the news, the government, or modern medicine.
And speaking of that, Black women are 4 times more likely to die in childbirth than white women.
Yeah. And so, and we feel like, and those numbers are different if they give birth at home. We could talk about that on another day. But so, and different in a positive way. Like you're going to have a more positive outcome with a doula, midwife. Anyway, so we want to give you some facts for everyone, but especially for most of our listeners in our community. So number one, I'm getting this from the CDC. Lynette is not freestyling on this. I'm reading it, actual data as of right now. Diseases can make anyone sick regardless of their race or ethnicity. If you do not see large numbers of Black people with this, just because it hasn't been promoted doesn't mean they don't have it. Just because you haven't been tested doesn't mean you don't have it. So just because you are not likely to die from it does not mean it should not concern you. Why should it concern the people, Greg?
Why should it?
Yes, why should you be concerned?
I mean, because it can affect any and everybody.
Yes, you could be a carrier. So maybe you won't die, and everybody in your household is reasonably healthy, young children, will recover from it. If you don't have any respiratory issues or diabetes, or if you're not, I think something I said, if you're not over 65, diabetic, or current health issues, and you're between the ages of like 6 and 65, you will probably, if you got it, would just be sick for a little while and then recover and be fine. Here's the thing. It's not airborne, but it lives on surfaces. And so because it's this little tiny thing that lives on surfaces, you can't see it. And so the reason they're encouraging people to not gather is because, number one, if somebody coughs or sneezes, that can travel, 3 feet, 10 feet?
3 to 4, yeah,
3 to
something
4
like
feet.
that.
So they're encouraging social distances. So you may even notice Crip and I are sitting a little farther apart than usual. Like I guess I could touch you,
but you gotta stretch.
You gotta stretch. We're greeting each other differently, and I know even that's culturally an adjustment.
Oh, I seen our black folks. We straight doing the elbow dap.
Yeah, we doing the elbow. I think I did the bump with a few of my homegirls. You could kid and play. We can be playful, but we can be playful about it. But I think
but still take it seriously.
It's worth taking seriously. Why not? What do you lose by taking it seriously? So I can think of a few things we can lose. So number one, school's been canceled. It's over. That's going to be a challenge. It's going to be a sacrifice for people figuring out childcare and what have you. Many workplaces are not closed. And so this creates some burden for parents of young children having to figure out what they're going to do. I have seen a lot of rallying, like people offering their homes, their services.
I see that too, which is dope.
Yeah, it's dope. It's dope. One of my favorite things in
together.
tragedies. Yeah, people are like, what y'all need? You know, people are willing to do errands, people offering comfort, people offering a place to keep your kids. But it's a sacrifice. I think I see a lot of things that aren't closed and trying to do business as usual. And I'm trying not to be judgmental. I know people have to live. Small businesses are counting on consumerism, and if people don't leave and buy stuff, they're going to suffer. I just think my concern is I don't want to be the reason why someone else is sick.